You walk into the kitchen and stop dead in your tracks because you cannot remember why you came in. A word vanishes right off the tip of your tongue in the middle of a sentence. You misplace your keys for the third time this week. And somewhere underneath it all, a cold little fear whispers the question you don't even want to say out loud. Is this the beginning of dementia? Am I losing my mind? I want to talk to you today, doctor to patient, because there is something almost nobody is told, and it could change everything for you. For a surprising number of people over 60, that mental fog is not the start of Alzheimer's at all. It's a side effect. A side effect of ordinary pills sitting in their medicine cabinet right now, including several you can buy off the shelf without a prescription. Pills you'd never in a million years suspect. Now hear me clearly right at the start because this is important. I am not telling you to throw out your medications or to stop taking anything on your own. Some of these drugs are genuinely important, and a few of them are actually dangerous to stop suddenly. I'll tell you exactly which ones. What I'm going to do is show you the 9 most common culprits that quietly cloud the aging brain, explain why they do it, and walk you through exactly how to work with your doctor to protect your memory. And here is the hopeful part, the part that gets me out of bed to make these videos. When a medication is the cause of the fog, that fog can very often lift. People get their sharpness back. So stay with me, because number 3 on this list is one you can likely address starting today. And number 4 is the one I'd most urgently caution you never to stop on your own. My name is Dr. Paul Brenner, and in over 30 years of caring for people over 60, I have seen patients walk in terrified they had dementia, and walk out months later, sharp and clear, after we simply cleaned up their medication list. Before we begin, please subscribe, because this is information that could protect your memory or the memory of someone you love. Let's begin. First, you need to understand how a pill can possibly cloud your mind, because once you see the mechanism, this entire list will click into place. Deep in your brain, there is a chemical messenger called acetylcholine. Think of it as the brain's memory and learning courier. It carries the signals that let you form new memories, recall names, stay focused, and think clearly. It is absolutely central to a sharp mind. Now, there is a whole category of medications known as anticholinergics, and that name simply means against acetylcholine. These drugs block that memory courier. They were never designed to harm your brain. They block acetylcholine elsewhere in the body to do their job, to dry up a runny nose, to calm an overactive bladder, to relax a muscle. But the blockade doesn't stay neatly where you want it. It reaches the brain, too. Take one such drug once, and your young self would shrug it off. But here is the danger for us after 60. Our brains clear these drugs more slowly, and we have less reserve to spare. And most importantly, these drugs add up. Doctors call it your anticholinergic burden, the combined weight of every acetylcholine-blocking drug you take. And a landmark study published in JAMA Internal Medicine followed thousands of older adults and found that those with the highest cumulative use of these drugs had a significantly higher risk of developing dementia. This is not fringe science. The American Geriatric Society publishes a respected list called the Beers Criteria of medications that are potentially inappropriate for older adults. And many of the drugs we're about to discuss are right there on it. So let's go through them one by one, starting with one you probably have in your house right now. Number 1, diphenhydramine. You know it by the name Benadryl. It's the old reliable allergy pill millions reach for, and it's one of the most powerfully anticholinergic drugs sold over the counter. People take it for allergies, for itching, for hives, never giving it a second thought because, after all, you don't even need a prescription. But that very drug that dries up your sniffles is also blocking that memory courier in your brain. And the older you are, the harder it hits. For occasional, rare use, it's one thing, but many people take it routinely, for years. If you use Benadryl regularly, this is one to talk to your doctor or pharmacist about, because there are newer allergy medicines, names like loratadine or cetirizine, that do the job with far less effect on the brain. Keep that in mind because diphenhydramine is about to show up again in a sneakier disguise. Number 2, the older overactive bladder medications. Drugs like oxybutynin, known as ditropan, and tolterodine, known as Detrol. Now, this one hits close to home for many of you, because if you've been watching my videos about waking at night to urinate, you may well be on one of these. They work by calming an overactive, urgent bladder, and they do it by blocking acetylcholine in the bladder muscle. But that same blockade reaches the brain. These older bladder drugs are among the most concerning on the anticholinergic list precisely because people take them every single day, for years, for a chronic problem. The good news is that newer bladder medications exist that are far gentler on the brain. And there are non-drug approaches too. So if you take a daily bladder pill and you've noticed your memory slipping, please do not stop it on your own, but make it the very first thing you raise at your next appointment. And that brings us to number 3, the one I said you can likely act on today. Number 3, and I want you to pay close attention here, the PM and nighttime sleep aids, and the secret hiding inside them. Tylenol PM, Advil PM, ZQuil, Unisom, generic nighttime pain relievers and sleep aids of every kind. Here is what most people never realize. The ingredient that makes them help you sleep is almost always an antihistamine. Very often that's same diphenhydramine from number 1, or a close cousin called doxylamine. In other words, that nightly sleep pill you've been taking for years, thinking it's harmless, is a powerful anticholinergic drug that you are dosing your aging brain with every single night while you sleep. Of everything on this list, this may be the most common, the most underestimated, and the easiest to address, which is why it's number 3. And why I want you to look tonight. Because these are over-the-counter, you can, unlike a prescription, simply choose to stop reaching for them and talk to your doctor about safer ways to sleep. And we both know from my other videos that there are far better, gentler paths to a good night's rest. If you take a PM pill or a nighttime sleep aid regularly, check the label tonight and make this number 3 your priority conversation. Now, take a breath, because number 4 is in a completely different and more serious category. And it comes with a warning. Number 4, the benzodiazepines. These are prescription sedatives for anxiety and sleep. Drugs like lorazepam, known as Ativan, diazepam, known as Valium, and alprazolam, known as Xanax. Research, including studies in the British Medical Journal, has linked long-term use of these drugs in older adults to a higher risk of cognitive decline and dementia, and they also dramatically raise the risk of falls. They are on the Beers list of drugs to use with great caution in seniors. But here is my urgent warning, and I need you to truly hear it. You must never, ever stop a benzodiazepine suddenly or on your own. Stopping these abruptly can cause severe withdrawal and in some cases dangerous seizures. So this is the opposite of number 3. With this one, the action is not to stop. It is to make an appointment and have a careful, supervised conversation with your doctor about whether a slow, gentle, doctor-guided taper might be right for you over time. Safe, slow, and supervised. Never cold turkey. Hold on to that distinction because it matters enormously. And number 5 is the close cousin people assume is safer. Number 5. The newer prescription sleep drugs, the so-called Z drugs, Zolpidem, known as Ambien, and Azopiclone, known as Lunesta. People often assume that because these are newer and aren't technically benzodiazepines, they're safe for the brain. But they act on many of the same pathways. They're linked to memory problems, confusion, next-day grogginess, and a serious risk of nighttime falls and even strange sleep behaviors. They too are on the caution list for older adults. As with the others, this is a conversation for your doctor about whether there's a safer long-term approach to your sleep than a nightly sedative. Let me pause right here for a moment because I want to hear from you. In the comments below, do me a favor. Type the number of different medications you take every day. Just the number, prescription and over-the-counter combined. 1, 4, 8, 10. I ask because the more items on that list, the more important today's video is for you, and I read every reply. And if this is opening your eyes to pills you never suspected, please tap the like button. It takes 1 second, and it helps YouTube put this in front of more people our age who are quietly frightened about their memory. Thank you. Now let's continue, because the next few are ones people take for years without ever connecting them to their thinking. Number 6. The older antidepressants known as tricyclics, the most common being amitriptyline, also sold as Elavil. Here's what makes this one sneaky. These days, amitriptyline is often prescribed not for depression at all, but in lower doses for nerve pain, for migraines, or to help with sleep. So you might be taking it for your aching feet or your headaches, never realizing it's one of the most strongly anticholinergic drugs there is. If you're on amitriptyline for any reason, this is absolutely one to discuss, because there are alternatives for pain and mood that are far kinder to the aging brain. Number 7. The older allergy and anxiety antihistamines beyond Benadryl. Drugs like chlorpheniramine, found in many old-style cold and allergy combos, and hydroxyzine, often prescribed for itching or anxiety. Same mechanism, same concern, same advice. If you take them daily, ask whether a newer, brain-safer option would work for you. Number 8. Certain muscle relaxants and stomach antispasmodics. Cyclobenzaprine, known as Flexeril, prescribed for back and muscle pain, and dicyclamine, used for stomach cramps and irritable bowel. Both carry significant anticholinergic effects, and both are frequently prescribed to older adults, who then take them far longer than intended. And remember, it's the burden, the stacking, that does the damage. A person taking a nightly PM sleep aid, plus a daily bladder pill, plus a muscle relaxant for their back, may have no idea they're carrying a heavy anticholinergic load from 3 directions at once. That stacking is exactly what the research warns about. And number 9, which I include with an honest note of caution about the science, the long-term acid-reducing drugs called proton pump inhibitors, omeprazole, known as Prilosec, and similar drugs for heartburn and reflux. Now, I want to be straight with you here, because I won't oversell it. The evidence linking these specifically to dementia is mixed and far from settled. Some studies raised the alarm, and later ones pushed back. So I'm not putting this in the same firm category as the anticholinergics, but there is a clearer, well-established concern that ties directly to your brain. Long-term use of these drugs can lower your body's absorption of vitamin B12, and a B12 deficiency is itself a well-known and very treatable cause of memory problems and confusion in older adults, something we've discussed before. So the lesson with number 9 isn't fear, it's this. If you've been on a daily acid reducer for years, ask your doctor 2 things: whether you still truly need it at that dose, and whether your B12 level has been checked. That single question has unfogged more than a few of my patients. So those are the 9. Now let me give you the part that actually protects you, because a list of scary pills is useless without a clear plan. And this plan is simple. The most powerful thing you can do is something doctors call a brown bag medication review. Here's how you do it. Take a paper bag and put into it every single thing you take. Every prescription bottle, yes, but also every over-the-counter pill, every sleep aid, every allergy tablet, every supplement, everything. Bring that bag to your doctor, or even better, your pharmacist, who is an absolute expert in exactly this, and ask them this specific, powerful question. Can you review everything I take for my total anticholinergic burden and tell me if any of these could be affecting my memory, and whether there are safer alternatives? Use those words, anticholinergic burden. Most patients have never said them, and they will get you a far better answer. Ask them to check your list against the Beers criteria, and then, together, you make a plan. Which over-the-counter items you can simply swap or stop, which prescriptions might be reduced or replaced over time, and which, like those benzodiazepines, must only ever be changed slowly and under supervision. You are not being a difficult patient by doing this. You are being a smart one. This is exactly the kind of review that good doctors wish more of their patients asked for. How do you know if your memory trouble might actually be coming from your medicine cabinet? Here are the clues to look for. Did your fog or forgetfulness begin or clearly worsen around the time you started a new medication or increased a dose? Does it come with other anticholinergic signs? A dry mouth, blurry vision, constipation, trouble urinating? Are you taking several of the drugs on today's list at once? And the biggest clue of all, the hopeful one. Medication-related fog tends to improve when the offending drug is reduced or removed, which is something true Alzheimer's disease does not do. That's exactly why this is worth investigating. Because if your memory loss has a reversible cause sitting in a pill bottle, you want to find it. Now, I have to be balanced and honest with you here. Not all memory loss comes from medication, and real cognitive conditions do exist and deserve proper evaluation. So if your memory concerns are significant, please get a proper assessment regardless. But checking your medications first is one of the simplest, safest, and most overlooked steps there is. And it costs you nothing but one good conversation. Let me tell you about a patient. I'll call her Eleanor, 74, a retired librarian, a woman who had spent her whole life surrounded by words. And words were exactly what she was losing. She came to me, and her daughter came with her, both of them frightened, both convinced this was the beginning of dementia. She was repeating herself, struggling for names, foggy all day long. But when I asked Eleanor to bring me everything she took, the brown bag, the picture told the whole story. Every night, for years, she'd taken a PM pain reliever to sleep. She took a daily pill for her overactive bladder, and she took an old-style antihistamine for her allergies. 3 anticholinergic drugs, stacked, every single day, quietly blocking that memory courier in an aging brain. We changed nothing abruptly and nothing on our own. We worked with her, and with her pharmacist, carefully. We swapped the PM sleep aid for better sleep habits. We moved her to a brain-safer bladder medication and a modern allergy pill. And over the following weeks, Eleanor's daughter called me, and I could hear her voice catch. I have my mother back. The fog had lifted. The words came back. It was never dementia at all. It was her medicine cabinet. I tell you this not because it happens every time. It doesn't. But because it happens far, far more often than anyone realizes. And it might just be happening to you or someone you love. So here is what I want you to do right now before you click away. And please just pick one thing. Maybe it's getting that paper bag and starting to gather everything you take, including the over-the-counter pills you never think to mention. Maybe it's checking the label on your nightly sleep aid tonight to see if there's an antihistamine hiding in it. Maybe it's simply writing down 2 words to bring to your next appointment. Anticholinergic burden. Just one step. Start there. Because your memory is not a small thing. It is your independence, your stories, your grandchildren's names, the whole record of your life. And if there's even a chance that a fixable pill is clouding it, that is absolutely worth one good conversation with your doctor. If this opened your eyes today, please give it a like and share it with someone you love who takes a handful of pills and has been quietly worried about their memory. Your share might be the reason they get those precious years of clarity back. And if you're not yet subscribed, join us, because every week I bring you honest, clear, doctor-explained guidance to help you stay sharp, strong, and independent for as long as possible. And finally, the most important reminder of all, so let me say it plainly one more time. Nothing in this video is a reason to stop or change any medication on your own. And some of the drugs we discussed, especially the benzodiazepines, can be genuinely dangerous to stop suddenly. This is general education, not personal medical advice, and the links between these medications and dementia are about increased risk, not certainty. Your job is not to quit anything today. Your job is to get informed, gather your list, and have that conversation with your doctor or pharmacist so the two of you can make every change safely, together. Take good care of that wonderful mind of yours. It has carried a lifetime of memories, and it's well worth protecting.